Hello and welcome to Talks at Columbia. My name is Dr. Jason Wingard and I am Dean of the School of Professional Studies. Talks at Columbia is a thought leadership series that features scholars and practitioners from Columbia University, as well as executives and practitioners from the industries all over the world. Today we are hosting a special edition of Talks at Columbia in direct response to the COVID-19 crisis that is affecting the world overall. The current pandemic has our school community at Columbia largely shut in and quarantined. We have shifted our instruction and our teaching and learning from the campus in Manhattan to the homes of all of these individuals globally in spaces all over the world in support of focusing on physical distancing and recommendations to quarantine ourselves socially. Today, we are very fortunate to be joined for a special discussion on COVID-19 by Dr. Brandee Waite. Dr. Waite is Director of Sports Medicine and Professor at the University of California, Davis. Most importantly, Dr. Waite is an Executive in Residence at the School of Professional Studies at Columbia University. Dr. Waite, it's great to have you with us here today.
Dr. Wingard, thank you so much for that warm welcome. I'm very happy to join you.
So we have a couple of questions that we want to ask you, and these questions have come directly from our students at Columbia University. So the first question, Dr. Waite, during a time like this, generally speaking, what kind of physical activity should we be doing to maintain and optimize our brain function?
There have been many studies over the years that show that aerobic activity, aerobic exercise is fantastic for maintaining and improving brain health. Some people have a hard time doing aerobic activity indoors, inside, but there are lots of ways that you can do it. First of all, though, people should give themselves a little bit of a break and not beat themselves up if they don't keep up with their normal vigorous exercise plan, but don't give yourself a complete excuse. A break is okay, complete excuse is not. We've got to maintain some level of activity, and there's lots of ways that you can do it.
So what about time? If you don't have time now to barely get everything done and you're overwhelmed, how in the world can you fit in being able to do some level of exercise? So what do you say to people who say, look, I hear you, doc, I want to do this kind of work, I understand it'll help me do better with my studies at Columbia, but I just can't fit it in?
You can do little bits of things, 10 minutes, 15 minutes here. I love recommending exercising while you're brushing your teeth, doing squats or hamstring curls while you're brushing your teeth, push-ups on the counter while you're waiting for something in a microwave. So all these little mini bits of time where you might not be able to get in a big workout, you could do a little resistance training or a little bit of stretching, and it will go a long way.
Okay, so no excuses. We got that.
No excuses.
No excuses. So in the news right now, there's a lot of coverage around hospitals, particularly in the US. They're discouraging the elective procedures, the elective calls for care. I know you deal with a lot of patients and you have daily check-ins, routine appointments to make sure that people's rehabilitative health is progressing. So there are a couple of questions that have come directly from particular programs of our students related to this topic. So I'll ask you now. So specifically from our bioethics students, they're asking, are there ethical considerations that doctors have to take into account during this time, particularly when those in government or other officials are saying, only deal with those patients who have non-elective procedures and needs. Those with electives you can put off. Are there ethical considerations that you have to consider about whether you should heed that advice or those calls or not?
Yes, it's very interesting because essential, elective, these are terms that have a little bit, soft ends around them. So, there's certainly life or death procedures or visits, there's urgent or emergent, and then there are things that are really critical. In my practice, I see a lot of people who have joint aches and pains. And sometimes joint aches and pains are minor, they're an annoyance and you can get through it. Other times it prevents you from being able to go up the stairs in your house. And if you live in an apartment where the bathroom is upstairs and your room is downstairs, that's a necessity. You have to be able to get up the stairs to be able to maintain sanitation and other things like that. So, it's very different depending on the location you are and how big the surge is right now. And in my practice, I've said, if you can't care for yourself and the people that you need to care for because of your pain level, then to me, that's an essential procedure or an essential visit that needs to happen. And then we're taking the precautions that we need to keep them safe and to keep our staff and faculty and the people who work here safe as well.
Our narrative medicine students have asked the question similar. So same context about elective procedures and working with patients directly or not. What kind of innovative approaches are you starting to establish now to make sure that their progress is going to be as fruitful as it once was?
People really appreciate a tiny bit of explanation that shows your physician's humanity and acknowledging their humanity as well. So, right now we have some patients that come in with a glove, with gloves and a mask on, and some of our staff are wearing gloves or a mask depending on what their situation is. And so the first thing we say is, we're going to get you in and out of here as fast as we can so you don't have, undue exposure, but we care about helping you get better. And we're going to take the time to do that. And I might do it from way over here instead of standing closer to you, but we're going to get you taken care of. I think just reassurance that their situation, their issue, their care is at the forefront of your concerns as well as their safety, I think goes a long way towards helping people. And then with the video visits, we had started doing this before COVID-19 pandemic came up. But the volume has gone up significantly. And I have been, truly surprised at how much people seem to like it. And we actually had someone who was just so grateful that they didn't have to wait 3 months to be seen, that they were able to get a video visit and get their concerns addressed, and some reassurance or just a plan for the guidance is very reassuring to someone, rather than just sitting at home and feeling nervous and having to wait for 3 months to get an answer to a question that's really, burning in their heart and mind and soul. So having that interaction, even though it's not in person, is very helpful for people.
So you talked a lot about, and we know you deal with elite athletes. So for elite athletes, what is the medical consequence of them delaying their training during this period for weeks or months, or maybe even for a year? What kind of impact does that have on their optimal peak performance?
It really depends on the type of athlete we're talking about. So someone who is a potential Olympic gymnast, this has much more of an impact on them than someone who, has a different type of sport that they compete in. I happen to know one of the head team physicians for USA Women's Gymnastics quite well. This has been devastating for these young women. I mean, they have a very narrow window, and they've been training for it. And so it's just basically shifting sort of to an off-season mode, and keeping up with the nutrition and the training that you would normally do during off-season, maybe taking some time to work on the sports psychology aspects of your game that you might not have time for during a regular busy season, and working with your athletic trainers, your coaching staff, the strength and conditioning coaches to put you on track to just adjust the timing. It doesn't stop the heartbreak of missing your season now. Especially, I think about the athletes who are graduating from high school or graduated from college, or who had a spring sport right now, and that's it. Baseball is not going to get seen. Track and field is not going to get seen. A lot of these things, and got college scholarships and, careers and things that are riding on it. So there's a lot of stress that goes on with that. But I think you just have to say, all right, if I'm going to hope that the Olympics are postponed and not canceled, and just say, okay, how do we just readjust our timeline? And you work with the professionals in your field. You work with the trainers. You work with the people who know how to manage that.
And so there you have it, members of the Columbia University community. You've just heard from Dr. Brandee Waite, Director of Sports Medicine and Professor at the University of California, Davis, and Executive in Residence at the School of Professional Studies at Columbia University. Dr. Waite, thank you very much for joining us.
It was my pleasure. Stay safe and stay healthy.
And to all of you, you have just joined us for a special edition of Talks at Columbia. Thank you very much for joining us.